Yeah. Hello, my name's Marion Langley. I'm the Unison Branch Secretary for Unison South Tyneside Health Branch. As we come together on this day to remember those who have lost their lives or been injured or disabled while carrying out their daily work, we can reflect on the changes that should have been made and legislation that should have been followed. However, there are still over 2 million workers killed in preventable deaths. Health and safety is seen in many organisations as a poor resource, a joker when it comes to implementing change for the better. Better if we can afford it, better if someone else pays for it, and some pay the ultimate price with their lives. The headlines around the world capture the moments when tragedy strikes, the pit disaster, the train crash, fire in a clothing factory in India, and many, too many more. I watched a TV series, The Crown, where the portrayal of the Aberfan disaster in Wales was shown. This was one of my early memories where lives were lost. It's when, as a trade unionist activist, you have to deal with the consequences of accidents at work, that these numbers and statistics become real. I'm pleased to say I've not had to deal with anyone who has lost their lives, but I have had to deal with members who, as a direct accident or injury at work, they have been left disabled and can no longer work. The nurse who was assaulted by a patient and as a result of the injuries left brain damaged and had their employment terminated on the grounds of capability, to the domestic who was tripped on a damaged floor and as a direct result of their injury can no longer walk without a stick, and also their employment terminated on grounds of capability. The effect this has on the staff and their families has everlasting implications, some psychological, some financial, but whatever way you look at it, it is life-changing for them. We should see health and safety in the workplace as a vital body, there to give advice and direction that demands to be followed. As we face the worst health crisis with COVID-19, we hear on a daily basis that along with thousands of the public losing their lives, we also are losing many of our carers, health workers and essential service workers all over the world. Health workers, these brave men and women, have paid the ultimate price and should be forever remembered for doing so. Preventing something may cost, but the cost of losing a life is irreplaceable.